Well, this young lady, we're doing our MMLift on her, which basically helps improve the tear trough, nasolabial fold, the marionette groove, lift the cheek, and also lifts the jowl. And we're going to be starting off by using a product called Restylane Lyft, which has a great ability to lift the cheek tissue, still be very soft and feminine, but stay where you put it, so you don't have to worry about it migrating into different parts of the tissue. All right, now I'm going to put your head back for me, and go ahead and take a deep breath at your.
I thought it was done.
Nahal is using our Pronox nitrous oxide system. We're clamping her nose here just to kind of keep her from nose breathing. Some people are nose breathers. She's going to take a few deep breaths of the nitrous oxide, and we'll get started with the Restylane Lyft. When we inject fillers in our practice, we use a blunt cannula. A cannula is basically a surgical instrument that is used to deliver the product into the tissue without creating any bruising and very minimal swelling. So you can go back to doing the things that you want to do a lot faster, and it reduces downtime significantly to about 24 to 36 hours, and reduces the risk of bruising by almost 98%. Okay, now pull that down and hold it in your lap for me. There you go. You're gonna feel a little sticker. Now first, we create the entry port. 1, 2, 3. For the cannula, and then we insert the blunt cannula into the cheek. And then we start injecting. Because the cannula is blunt, we don't have to worry about cutting through any muscles or nerves or vessels, creating any trauma, or increasing the risk of bruising for our patient. And because we're not doing any of those things, it really reduces the recovery process for the patient. We're currently treating her tear trough area. I'll take this off and away from this. And you can see the tear trough area is responding very nicely. We're going deep down on the bone. And now with Restylane Lyft, one of the nice things about Restylane Lyft is you can also treat the superficial tissues without having to worry about any kind of Tyndall effect, which is a blue color to the skin. It's a very, very soft filler. It's already starting to fill in that tear trough. I'm going to have Nahal show us here in a second. We're going to do the outside of the eye now. So it's a little bit tender on the side. And we're going to massage this area. If you set up for us, we'll show. And so this is a partial result, what we've done for her in terms of filling in the area around the eye. It softens the shadow, the same shadow she has on this side, and lessens the harshness of the shadow so the light doesn't hit it quite so badly. And that's a tear trough injection with a cannula.